In this video, we're going to begin discussing the McKenzie approach, which is a method of treatment that's most commonly used for patients with low back pain. Some patients with low back pain have what's called a directional preference, and the McKenzie approach takes advantage of that. The directional preference we'll be looking at here is lumbar extension. But first, we need to understand a couple of terms. And the first one that we're going to talk about is actually this one, peripheralization. Now, regardless of whether a patient's going to be doing lumbar extension or we'll see lumbar flexion in the next video, the McKenzie approach is very useful for patients who have two things. Number one, low back pain, and number two, radiating symptoms going down one of their lower extremities. If we look over here on the right picture, this little circle right here in the lumbar spine, where my mouse is, that represents the low back pain. But notice you also see this darker, thick line going down the right lower extremity. That's representing that there are symptoms also radiating down all the way to the foot, basically down the right lower extremity. Well, if the symptoms were to peripheralize, it would be a migration, so to speak, of the symptoms into the periphery from the lumbar spine. So maybe the symptoms start out just in the low back, like you see over here on the left. But with certain movements, you can see as we go to the right here, the symptoms peripheralize more and more. At this point, they're kind of just into the patient's buttock, but now they're going down to the patient's knee and ultimately down to the patient's foot. Movements that peripheralize are ones that we do not want to use. Peripheralization is bad. We actually want the symptoms to be going in the opposite direction. So these symptoms that are going all the way to the bottom of the lower extremity, we want them to retract back up the lower extremity and essentially just be concentrated here in the low back. And that process is centralization. So centralization is the migration of symptoms away from the periphery and toward the lumbar spine. And movements that centralize are good and are used in the treatment of that patient. And note that sometimes with centralization, you can actually have an increase of severity in the low back pain. That is okay as long as the symptoms in the lower extremity are retracting back toward the lumbar spine. So finding a directional preference means finding a series of positions or movements that appear to centralize the patient's symptoms. Now over here on the left, you see the general McKenzie progressions for lumbar extension. Generally, you'd have the patient start in prone, and then you'd move to prone on elbows, which goes by other names, as we'll see in a minute, and then prone on hands, and then prone press-ups, and then finally repeated extensions in standing. And note that you're not necessarily going to give prone positioning for every single patient on the first visit. The patient can enter into this progression at any point. So for example, I recently had a patient who had a directional preference that was lumbar extension, and I ended up giving him prone on hands. He was fine in prone, better in prone on elbows, and even better in prone on hands. And so that's what he was given on the first visit. And the patient will progress to the next position or movement when the symptoms centralize and no longer peripheralize with the movement. Okay? So back to that original patient. I said that I gave him prone on hands on the first visit, and I did that because that position centralized his symptoms. But it turned out on the first visit, a full prone press-up was a little bit too aggressive. Now let's say he goes home and practices that prone on hands position. He does it over and over again, and throughout that week in his day-to-day life, he has less radiating symptoms overall, but he still has some. So he comes back and he tells me, you know, the prone on hands is really good. I can tolerate that really well, easily centralizes the movement. So then I'm going to try prone press-ups. And maybe that second week, now he's able to tolerate this and still shows centralization with the prone press-ups. So now I'm going to progress him from prone on hands to prone press-ups. So you always progress the patient when their symptoms centralize with a particular position or movement and no longer peripheralize, and they can tolerate the progression. So now let's discuss each individual part of the lumbar extension McKenzie progression. The first is really just sustained prone positioning, as you see right here. Now, most patients that come in with an extension directional preference, you're going to be able to progress beyond this position to one of these down here. But if the patient's symptoms, their pain is very severe, this might be all they're able to tolerate in that session, and that's okay as long as the position centralizes their symptoms. And sometimes in here we'll even put a hot pack on their lumbar spine to help with pain management. Now, assuming that the patient's symptoms centralize and they can tolerate it, we can progress to the prone on elbows positioning and just hold it, as you see here in the picture. Now, this position is also called prone on forearms, and I actually prefer that terminology because, as you can see here, the weight is through the entire forearm, not just on the elbows. And this is also called the Sphinx position because it resembles the Great Sphinx in Giza in Egypt. Now, we can certainly do this as a sustained hold, or we can actually do a transition between prone and the Sphinx position. And notice that as we begin in prone here, we have a little bit of that lumbar lordotic curvature. As we go into Sphinx extension, we get an increase in that lumbar extension. And we can do a certain number of repetitions of this. Normally we'll start with 10, okay? And you want to make sure that this movement is slow and controlled. This is not power, this is not speed, this is not strength, this is about control, okay? Slow and controlled is better. Now, assuming the patient's symptoms centralize here, and they can tolerate it, we can then progress to the prone on hands position and just hold this. Now, the prone on hands that I'm talking about here is really a partial prone press-up position. Partial in the sense that we're not pushing fully through the elbows. Notice the elbows are not in full extension. If I were to push up all the way into full extension, which we'll see in just a minute like that, notice I get an even greater lumbar lordotic curvature, more lumbar extension. That might be too intense for people. So we want to dial it back and do a partial prone press-up position. Okay. Notice in this position, my hips are still in contact with the table. It's not a full push-up. Okay. Now I can certainly hold this position, or I can move through a partial prone press-up. So that will look like this. Again, notice it's partial. So I'm not extending all the way through the elbows. But again, as I do push up, I get an increase in lumbar extension. Again, just like the previous movement we saw, it is slow and controlled. We're not doing speed here. Assuming the patient's symptoms centralize here, and they can tolerate it, we'll then progress to a full prone press-up. Okay? Here's the full prone press-up position. Again, notice here, hips are still in contact with the table, and I'm pushing fully through extended elbows. Again, you can hold this position, or you can move through the full prone press-up movement, which will look like that. Now notice that when I come down, I'm not coming down all the way. Again, there's no rule that says you have to stop short. You can certainly have the patient come all the way down to the table and then push all the way back up. It's all about what centralizes the patient's symptoms. Also understand that this movement and also the partial prone press-up is going to be challenging on the tricep muscles. Okay? So you want to make sure the patient has sufficient upper extremity strength if you're going to be giving them this. Now, assuming the patient's symptoms centralize with this movement, and they can tolerate it, you can then progress to the final progression, and that is extension in standing. And a lot of times this is called repeated extensions in standing, or REIS for short. Okay? So what I usually say to do is put your hands on your hips, and you're just going to go through lumbar extension, like this. I'd usually recommend having something behind them, whether it's the treatment table or a chair, just in case they happen to fall backwards. It's right there for support. Here's a look from the side so you can see that lumbar extension right there. Again, you're only going to have the patient go through a range that they can tolerate and that centralizes their symptoms. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.